Hello, everyone. I'm Jefferson Wu from Taipei General Hospital, and I'm also the chair of the communication committee of the IHS. Today, we invite Scott Yan. He is from the Thomas Jefferson Headache Centre, and we want to talk about the linkage between the BMI and the IIH.
Thank you so much, Dr. Wu, for the invitations. My name is Scott from Jefferson Headache Centre. Today, I will be sharing some of my research finding on the BMI and opening pressure. So you all know, body weight plays a major role in the development of idiopathic intracranial hypertension. However, I believe that is not that simple. So in our study, we collect not just only the BMI opening pressure, but also the elastance and the torcular pressure through the venous manometry. When we put all these factors together in a multivariate analysis, and we show that the torcular pressure and the elastance, as well as the BMI elastance interactions, become significantly correlated with the opening pressure. At the same time, BMI, however, was not. So we show that in patients with higher elastance, the BMI's relationship will be more stronger than those who have lower elastance. So we believe the BMI's the role of BMI in IIH is not that straightforward. We also have to consider the elastance factors involved.
And one question about your research is that how to measure the elastance of the venous?
That's a great question. So for this, we collaborate with our endovascular neurosurgeons. So they do digital subtraction angiography, and also they do the retrograde venography. So after the venous retrograde venography, they will put in a pressure catheter, and they will withdraw the catheter slowly and to capture the pressure of the sinuses. That includes superior sagittal sinus, torcular transverse sinuses, sigmoid, and internal jugular vein areas.
Whoa, it's a very solid method to measure the elastance of the vein.
Yes, so that is measuring the sinus pressure. The elastance was measured by the lumbar puncture opening pressure divided by the closing pressure, lumbar opening pressure minus the closing pressure divided by the volume of CSF removed. It's a crude way to assess the elastance. We all know that the elastance pressure curve is not linear, but we use that as a way to represent there are additional factors coming from the spine that contribute to the measurement of opening pressure.
And another question is that what is the mechanism behind the interaction between the BMI and elastance and the open pressure?
That is an excellent question. So BMI is not just the adipose tissue distribution in the belly. Is the abdominal tissue can also affect the intra-abdominal pressure that will push back to the venous plexus inside the spinal canal. In addition, elevated BMI can also increases the volume of the adipose tissue inside the spinal canal. So all these can play a role in changing the environment in that spinal canal. Therefore, you change the elastance behavior inside it.
Okay, so regarding the relationship between the BMI and the pressure, I have one interesting question is that several physicians, neurologists apply or suggest to the body weight loss to improve the IIH. So what is your opinion about the body weight loss as a treatment strategy for the high pressure headaches?
Dr. Sinclair's group, they evaluate medical management versus surgical management. They show that the more like bariatric surgery will have a long-lasting effect. So we know that body weight management works. And recently there are two studies publishing at the same time, one on JAMA Neurology and one in Journal of Neurosurgery. They use TriNetX data and show that using the GLP-1 receptor antagonist has been associated with the reduced need for further invasive surgery. So we believe the body weight management is important in the management of idiopathic intracranial hypertension. It's just which method is the best way remain to be determined. From a neurologist perspective, of course, we advocate optimizing the medical management before more invasive surgical treatments.
Okay, so the last question. Based on your research finding, what is the implications of the future treatments of the IIH?
So our findings suggest that when we evaluate a patient with IH or the opening pressure, we cannot just look at the opening pressure alone. We should at least take the opening pressure and the closing pressure and to assess the elastance, because different elastance may have a different impact on the pressure response, because the elastance is pretty much a change in the pressure in a change with the same amount of the volume. So with a higher elastance, that means the same amount of volume removed from the patient can have a more stronger impact. So right now, most of the time when we do the opening pressure measurement, we just collect the opening pressure and then we walk away. But with these studies, we highly recommend adding not just the opening pressure, but also the closing pressure and also the CSF volume removed into the equation.
Okay, thanks to the comprehensive introduction of your cutting-edge research, and I would like to talk to all of you that in the for the IIH, not only the BMI but also the elastance does matters. So thank you everyone for listening for our interview.
Thank you so much.